because as supervisors, we've been noticing that a lot of our conversations that we're having with groups and on a one-to-one basis have been talking more about boundaries recently. And also just noticing, in the wider field of coaching, in terms of the professional coaching bodies and the messages that are being communicated at the moment about mental health in coaching, we wanted to provide you with a space to really reflect on this topic for you and really start to explore what the boundaries are. And so when I was thinking about pulling this session together, I was delighted that my esteemed colleagues, as you can see on the screen in front of you, could all join me for this session. So I'm just going to do some quick introductions in terms of the panel today. So Judith, some of you may be familiar with Judith. So there you go. So Judith's experienced executive coach and team coach, a coach supervisor as well. So I've worked with Judith for a long time now. Previously, Judith worked alongside Chris with Miles Downey at the School of Coaching as well, and was the co-director of the Psychosynthesis Trust in London as well. So was previously in a previous life a psychotherapist as well, Judith, weren't you? So welcome, Judith. And then we've got Chris, and again, I'm sure Chris is familiar to many people on the call, but Chris is again an experienced executive coach, team coach, coach supervisor. Chris and I worked together at the Performance Coach for many years, and prior to that, as I said earlier, Chris worked alongside Judith and Miles at the School of Coaching as well. So welcome to the session, Chris. And finally, you've got Sandra, and I know some of people on the call on our programs will recognize Sandra. She oversees all the accreditation on our programs, but Sandra is also a business psychologist and an executive and team coach and coach supervisor as well. So really pleased Sandra could be here. So welcome, Sandra. Okay, so we're going to have a bit of a structured conversation around boundaries. There's a few questions that I've pulled together that I do want to ask the group today, but just a moment just to pause and just to say, please feel free to add any specific questions you're holding at the moment as a coach into the chat panel around boundaries, mental health, just so we get a sense of where the group's interest is as well. So I'm just going to pause for a moment, and if you click on chat and put questions in the chat panel, Chris, Judith, Sandra and I will get a sense of where your interest is as well. So please feel free to add those. Any questions, any outcomes you're hoping to get from today's session? So hoping some are going to come through shortly. Okay, thanks, Robin. I can start to see some questions coming through.
Yeah.
Thank you. So it looks like we're going to touch on the questions that are coming through so far. So let's start, and then we can bring some other questions in as we go through. So Judith, I'm going to come to you first, and let's just start with, I suppose, some clarity around how you're seeing the boundaries, so the definitions that you would use, when you're supervising coaches.
Okay. So I want to just start by sort of the heading mental health, just to say we are all living through a pandemic, which is something that for most of us is new to be in such a critical existence. So there will be issues for many people, underlying issues that are surfacing, whether they're being coached or whether they're just living or whatever. So just to say, I'm not surprised that this topic is coming to the fore at the moment. I also wanted to say, in terms of mental health, if you think of mental health as kind of top line, actually there's a spectrum of issues that we would be dealing with as coaches. And for me, mental health breaks down at one end to mental well-being, actually. And on the other end, which I think is the end that many of us perhaps struggle with a little bit, is mental ill health. And that's probably the more challenging end of the spectrum. So I have a very simple little model that I wanted to introduce you to that may help a little bit with this conversation, just to kind of set the context for the conversation. Now a good time, do you think, Damien, for that? Okay. So what we've got here is one of the forever a quadrant model. Along the horizontal line, you've got skills. And these are skills, you'll recognize these skills that many of us have in coaching. So we would start with the most basic skill of active listening, which can provide support for people. We also will learn challenging skills, or as coaches will have challenging skills, which are sort of a little bit further down the line. And next to that, there may well be confronting skills. And then towards the very end of the line is something we're calling containment. And the reason why it's at the end of that line, I'll get to in just a moment. On the horizontal, on the vertical line, you've got at one end, the top end, something that I'm just calling pathological disturbance. What this means is that people who have got serious mental illness issues, mental ill health issues. Whereas down at the bottom, we've got something that we're calling a healthy coping adult. Most of us will spend time being a healthy coping adult if we are a working individual with sufficient resources to live our lives in a good enough manner. But all of us at some time in our lifetimes will have experiences of some kind of, I'm going to do inverted commas, pathological disturbance. So, for example, very normal for people to feel disturbed in a pandemic when we're living in lockdown. Very normal for people to feel perhaps depressed or oppressed in this sort of situation, and all the emotions or lack of emotion that go with those things. Life crisis generate in us disturbance, so any kind of loss, whether it's a death of a beloved or close family, or whether it's loss of a relationship, loss of a job, something happening to where we lose our sense of identity, all of these things will evoke stronger emotional reactions, which can leave us feeling disturbed. Now, in its extreme, then we becomes pathological. But for most people living their lives, and I'm going to make an assumption here, too broad brush really, but I'm guessing that for many of the people that you're coaching, many of the people that I coached, the kind of disturbance I engaged with was people with life crisis, actually, or work crisis. Just really quickly, if you have active listening skills and you know how to offer support, you can work with a very wide range of people. And I say work, what I mean is you can listen to and be kind to a very wide range of people, including those that are further up the psychological disturbance end. If you are going to bring in the skills of challenging and confronting, what we know is that when we begin to challenge people, it will tend to disturb them in some way. That's the intent of a challenge. If we're confronting people, it will disturb them in some way. If that person is a healthy coping adult, challenges and confrontation, we might call raising awareness or personal development. If you're challenging someone who has mental ill health or is very imbalanced, they will need more specialist support, and that support would be called containment. So, for example, I'll just give you two examples. Someone who is very psychologically disturbed, pathologically disturbed, may well need the kind of a containment that a psychiatrist can offer. And that would be at the most extreme, a place of safety, or less extreme, or perhaps, and also chemical containment, something that will help manage the disturbance. And you can see there are a variety of individuals who would be trained to work in that top quadrant to a greater or lesser degree. Coaches, I've always put coaches sort of in the middle, that coaches can offer guidance and counselling. They can offer just active listening support. They're working with raising awareness and some sort of personal development that comes out of business coaching. And unless you've got additional training, I would say the areas where we need to be alert is up in that top right quadrant, when people don't seem to be able to be coping very well. So that's all I'm going to offer for the moment.
Thanks, Judith. Thank you. Really, really useful in terms of that sort of continuum you spoke about. Now, also just thinking about these quadrants, and it does lead to the next question, actually, which I'm going to sort of pass to Sandra. So I'm sure, you know, coaches who are listening to this and reflecting on that model might be reflecting on their personal boundaries as well, Sandra. So, you know, when you hear that question, you know, in supervision, what are my boundaries? If a coach is asking you that, what would you like to share around that? And you're on mute at the moment, Sandra.
Thanks, Damien. And thank you for the question. I'm conscious that as coaches, firstly, we're coming from a diverse range of experiences, previous work careers, and various professional disciplines. So in terms of what we come with and what we offer, there's already a diversity there. And I was thinking about this word boundary, been reflecting on it. And for me, there are, if you like, a number of, and I'll share three key aspects of it. And it's firstly the purpose of coaching, the practice principles of coaching, and the process of coaching. And for me, when I think about the purpose of coaching, and I'm not quoting any of our famous theoretical gurus or practicing gurus, but it's really about facilitating client growth and personal effectiveness. That's how it stands for me. And in thinking about that, then I was thinking, well, as a coach, I'm in bed with, or I'm at least in the same dormitory as our colleagues who are practicing mentors, counselors and therapists. And yet the differentiator is, and this is where the boundary starts to come in, is in terms of the focus of our attention and how this is explored. And what Judith did in terms of that top right quadrant was really start to articulate that. So for me, that's a first touch point of boundary. The next touch point in terms of ourselves as coaches is about being ever mindful of what the underpinning principles are of coaching. And for me, it's about coaching working with our clients in terms of a forward-looking journey that they're taking us along. And yes, there are pit stops along the way that we explore, that there's unearthing and so on and so forth, but it's forward-looking. The developmental ethos, that it's about providing this safe space for client reflection, understanding, appreciation, and therefore application for action. And lastly, that it's a finite relationship. For me, that's quite key in terms of, well, what can we actually work in partnership with client to grapple? People in that top right and the specialist interventions there, those are ongoing relationships, I suspect, far longer than our relationships that we have typically with our clients. And lastly, the process of coaching, for me, the bedrock of that is contracting and this safe space that we are creating for our clients to share. For me, part of that again is about really being clear with myself what my remit is as a coach in working with my client, And part of that is my self-contract with myself in terms of my confidence, knowing my limits, essentially, knowing my limits. And then also, in so doing, working with clients to really gain a shared appreciation of what they're bringing, their sense of being. So again, Judith's framework there has really helped. It's taken me back to my initial training when coaching and indeed mentoring were people who were, and I'm paraphrasing here, were can do, could function, and were willing. People further down on the mental ill health predominantly, possibly, and therefore counselling, therapeutic interventions, were people who were willing, but for whatever reason were less able to function. And again, I think that's what Judith was really flagging up for us. So contracting for me is key about getting a sense of myself, getting a sense of the person and how we are going to be able to work together, and actually using that, working with that in the moment as a container, starting to create a container for what they're bringing and where that might sit in terms of the parameters of coaching and the remit of coaching.
Thanks, Sandra. Thank you. So, and I just wanted to add in, as well as the sort of the frequency is another aspect of that different relationship as well, in terms of the way it's set up and how many contact points there be. So Chris, I'm going to come to you actually, just to see if there's anything you want to share, just to build on anything that Judith and Sandra have shared so far. But I suppose also just, you know, for a lot of coaches, being able to work effectively in the moment when these matters arise. So just what other views have you got around how we can be more effective in the moment, Chris?
Damien, thank you. And I think Judith and Sandra have already outlined so many of the important principles around this. And I think I'm mindful in working with a couple of NHS trusts at the moment with large groups of psychologists and psychotherapists who are clearly deeply concerned about the mental health of their staff, with high levels of stress and pressure, with watching bereavement on a constant basis in terms of their patients, and also in terms of actually watching some of their own colleagues pass away. The impact of that is huge. And you take that back to the actually day-to-day, a number of clients who I'm sure many of those on the call will also notice of just the level of stress for people who are caught homeschooling in a small 2-bedroom flat with a husband on furlough, a lot of work to do, trying to look after 2 kids and run a job. And there is that enormous range, I think, that we're experiencing. And I think, just to re-emphasize, I think it is a lot about function. So remembering the function of a coach is there to support development at some level. And it may be a very poor analogy, but if we put this in a sporting context, if I'm coaching somebody for their development and they're carrying an injury, which means actually they can't develop well, they need to attend to the injury. And I think it is up to us in the privilege of having a space where people are being open to us to be mindful of that injury. Is it just a little strain that's being picked up and is going to probably recover in a month or 2? Is it something a bit more deep-seated? I think the challenge is often in the moment. And if I think back of my experience, I think it is the first time somebody reveals something to you which it can create in a moment of actual panic in ourselves of, oh my gosh, how am I going to deal with this? And neurologically, we can recognize that sense of fight, flight, or freeze of what do I do with this? When somebody says in the moment, yeah, I had a lot of suicidal tendencies when I was a young woman. Or that, and I haven't been sleeping for months actually, and I'm having big emotional outbursts. Or that life is not worth continuing. Is in that moment, how do I respond to that? And I think what I've certainly learned from Judith in my long time working with her is, I think, one of the qualities that she and Sandra brings as well, is having been exposed to that quite a lot, it is less of an impact. So I think my first invitation is just to breathe and recenter yourself, because it is a matter of not just containing the whole situation, but containing yourself, just for the start, and notice that response. I think in terms of all the good coaches who are on this call, of the recognition of first being able to listen and acknowledge to what is heard. And not to do the terribly British thing, which is, as a slight tongue-in-cheek, is to talk about the weather, or to try and switch the subject. Actually hear it, acknowledge it. I think the next point is to recognize whether this feels isolated, or whether it is backing up in terms of a cluster of evidence that you have developed over time. So does this feel really strange? This person feels very healthy coping, they've just admitted something, which might be just a further place of deepening the relationship, and actually it's something they're sharing. Or is there something which is building an evidence of this feels really, really fragile? And it's sending up some alarm bells for me. And I think in that moment is, again, my invitation would be, and Judith and Sandra and Damien, yourself and your experience may build on this. First is to listen and acknowledge. I think it is important to sometimes invite the other person, rather than this landing on you, to invite their thought of, sometimes in an emotional response to that, of what they need in the moment. So actually let them express actually what they're needing from having shown you that or told you that. And I think that then there are some decision points for you as a coach. And it may be a place of something that feels that can be developed over time, which is this may be one piece. I'm just going to keep my awareness of that and let the conversation run a bit further. It may be a piece that actually you think this is a bit of a tipping point in terms of, I'm now really concerned about this person. And in that piece, my invitation is you're going to have to trust yourself. But my invitation is to name it. And to name it actually for yourself. Of, I notice, as you hear say that, I notice other things, it's raising some concerns for me about how you are. But I would invite the conversation to be a partnership, not to suddenly become the authority of mental health, but just to name that as something. And there are so many complexities around that. I think it can go in so many ways. But I do think it's important for the coach, for all of us as coaches, to know who to refer to understand who we would actually call, to understand the numbers actually that we could provide they could ring. And if you do go down that route of referral, to follow through. So not pass it over and forget, because lots of instances where I've worked with clients where they're having psychotherapy or seeing psychologists and still coaching. But going back to Sandra's point, the boundaries are very clear. And I think the last piece of this, which occurs to me, is I think one of the wonderful things actually that psychotherapists have to go through is they have to work for many years with a therapist themselves. So they get to know themselves quite well. And I would invite anyone who is listening here as a coach to also recognize, am I getting coaching? Because the danger is we offer coaching, but we don't actually engage with our own profession. So we sell something we don't use. The second bit is, do we have supervision? Because for me, both in supervising others, but being supervised myself, if something like occurs in a session that's given you a bit of a shock, given you a bit of a sense, how do I take that to somebody who can actually allow me to come back to my center so I understand where to go with it? And so that's, I think, the other encouragement I would have. I throw it back to open you.
Thanks, Chris. So Judith, I'm conscious of time, and then I suppose there's about 3 minutes that I'd like to come to you. Just anything you just want to build on in terms of perhaps what Chris just shared there, but also just looking at some of the questions and comments that have come through, thinking about referring a client on. and also having resources or a
Yeah.
resource list that we can share. Just
Yes.
what thoughts
Can I
have you
just
got?
quickly do that? I mean, there were some
Please.
very interesting questions, some very important points came up,
Mm.
but I think we sadly don't have time to. So for those of you that work in-house, it's likely that you've got employee assistance programs, and generally there you've got access to all kind of mental health professionals. First port of call for a lot of people would be, who don't have that, would be actually to suggest the person see their GP if it's something that is really seems to be a larger problem than you can handle. So GP is one first port of call. The other is to actually create for yourself a list of people that you trust or have, you know, to be trustworthy, counselors and psychotherapists who would be available to work one-to-one. Problem with that is that a lot of them, of course, are working in private practice, and that can be really expensive. So if you any kind of sort of support provided by the NHS, there's pretty long waiting lists, but it is there for people. So you've got GP employee assistance programs. There's something called the BACP, the British Association of Counselling and Psychotherapists, which is a very well-respected body of individuals who practice psychotherapy and counselling, and you can find them on a website, counsellors near you with specialisations. But I think it's always good to have build a list for yourself by talking to people, talking to other colleagues who may know individuals that can be referred to. So that would be my point.
Thanks, Judith. Thank you. So just sort of pulling things together, I think this may be a topic that we come back to, looking at some of the comments and reflections that have come through. I do want to say thanks to Sandra, Chris and Judith for their input today. I hope there's some useful initial thoughts and frames for you to take away when you're thinking about this topic for yourself at the moment. Just a couple of updates for you just before we close the session. The first of these, just a signpost that the next webinar is taking place next month on the 15th of March at 1 o'clock, and that's going to be on coaching senior leaders in transition. So please do rejoin us for that session. And then just to point out that next month we're going to start to advertise our annual gathering for this year. So this year it's going to take place on the 16th of July, and the theme for this year is going to be the dynamics of team coaching. So Judith and Chris will both be making an appearance on that session, running a couple of sessions for us. So you can see there the list of the topics so far. You're going to have the option to join 3 CPD sessions over the course of the day. So we will be sending information out about that one as well soon. So as I said earlier, I hope this session's been useful. Thanks for dialing in. Thanks for your comments. And we will pick your questions and reflections up, and we will look at doing a future session for you. Thank you very much.